If you can positively identify the symptoms of oral yeast infection, you have the best chance to avoid suffering from long-term oral yeast infection symptoms. Oral yeast infection, also known as thrush, infects the tongue, the mouth as well as gums and in. How to treat oral yeast infection. Oral yeast infection can be treated quite easily compared to other yeast infections. However, you should not allow to develop the infection because it can cause more serious conditions. Other parts of the body including kidneys and lungs might be affected, and you also risk to infect other unsuspecting people. A person who has noticed that he or she suffers from oral yeast infection should at first understand which symptoms oral yeast infection shows and in which form you can expect it to appear. You have to understand first of all that fungus which causes yeast infection is normal and will not necessarily affect a healthy person. Fungus becomes dangerous only when a certain amount of bacteria is present in the body. Candida fungus grows sometimes because of a certain hormonal balance and chemical changes in the body. This in turn leads to development of oral yeast infection symptoms. On the other hand, the balance of good fungus can be upset by certain antibiotics. This can also be the case when the immune system is weakened. The common oral yeast infection symptoms are white patches on the gums. You will also feel swelling as well as pain. You will also notice a certain discard that resembles cheese and smells like beer or fresh bread in your mouth cavity. The cavity of your mouth can also develop layers of cheesy material. In this case, it can take many weeks to treat those symptoms, and you should start with the treatment immediately. If you don't treat these yeast infection symptoms in time, this might affect your esophagus and your stomach. If you want to identify oral yeast infection symptoms at an early stage, you have to understand the different risk factors. You should know that also little babies can develop oral yeast infection. In fact, babies and newborns and even senior citizens are very prone to developing oral candida. Seniors who use dentures are more likely to develop this condition. If you fail treating oral candida in a timely manner, or if you neglect getting proper treatment, this yeast infection can last for a long time. Still, it is possible to put a permanent end to the symptoms. In order to reach that goal, you will have to change your diet. You can find a lot of information about proper diet if you look at diet plans for normal yeast infection.
Freedom is ringing. For whom the bell tolls, freedom is living. It's born as we grow.